How much does ear pinning cost? Can I finance? What are the chances that my ears will return to the current look? As you can tell, my ears stick out quite a bit. My whole life I've been bullied and have taken extreme measures to hide them, like tie a shoelace around my ears for a couple years, to the point where it left a dent on the top of my head, to gorilla taping them back, and in the process of taking the tape off, ripping some of my hair out of my head. I refuse to show my ears, and I am 23 years old. I just want to be able to go swimming or tie my hair up on a hot day. I'll never feel confident without surgery.
Thank you for your question. You submitted a question where you describe how distressed you are about having prominent ears, and you have submitted some photos in an interesting way where I can see part of the ears in different angles and get somewhat of a sense of what your concern is. And you want to know about ear pinning surgery. So what I'll do for you is first educate you a little bit about what happens commonly for people who have prominent ears and what the steps we go through in a cosmetic surgery practice like mine. I'm a board-certified cosmetic surgeon. I've been practicing in Manhattan and Long Island for over 20 years. And ear surgery of different types do come to our practice. And when it comes to prominent ears, we have to do a proper analysis to give you a sense of what is recommended, and then we'll discuss the options that we offer. So when we look at an ear, we're looking at a few key elements when someone's main concern is about the ears being prominent. There are three parts to this area. One is called the underdevelopment or lack of development of the antihelical fold. The other is called conchal bowl hypertrophy or prominent concha. And then the third is a protuberant or a more outwardly pointed earlobe. So in general, when people complain about prominent ears, we have to anatomically identify if one, two, or all three of these elements are part of the situation. Now, the surgery for prominent ears is referred to as otoplasty. Otoplasty, oto meaning ear, plasty meaning to change, from the Greek word for plasty or change, plastikos. So when making a decision, it's generally desirable to try to do the procedure in a way that is predictable, that is consistent, and likely to succeed. In my practice, what I generally do is, for a typical situation where all three elements are part of the whole complex, in other words, lack of development of the antihelical fold, a prominent concha or the central part, and the protuberant earlobe, we'll do something called a surgical otoplasty. Now, what this involves is doing procedures that are from behind the ear, inside the crease of the ear. All the work is basically done from there. And what we're trying to do from behind the ear is recreate the fold. If there is too much of this conchal bowl, then we resect part of that and then bring the conchal bowl against what's called the mastoid or the mastoid fascia. And then the prominent earlobe is also brought in, and that's kind of more in the design of the incision. Now, this is somewhat in contrast to other procedures which you may have heard of, like a setback or pulling back the ear. The important thing is identifying the anatomic issues. I mean, every surgeon who does this has their preferred technique, and in adults, we have the luxury of doing this with a little bit of cooperation, because this type of surgery we routinely do, I should also mention, under local anesthesia with light intravenous sedation. So one of the many challenges is that first we have to create an aesthetically nice looking ear, and then we want to have the ear symmetric with the other side. So we want all elements of the ear to look good. Now, one of the things to also understand about this surgery is that when the person heals, there may be some asymmetry, and sometimes you have to go back and do enhancements. That's in our practice. We explain that to patients, that if they need enhancements, whether stitches break, or if something happens where the earlobe is still a little bit prominent, you can always enhance those areas. But for most people who are older than teenagers, this is the way we do the surgery. So what you have to, I think it's important that you now meet with qualified, experienced cosmetic surgeons, because even though you're submitting a good set of photos, you're not going to get a true sense of what is needed unless someone does a proper physical examination. Once that physical examination is done, you understand the risks and benefits of doing this surgery, and of course learn about where the surgery is done. My personal bias is, because we have office-based surgical facilities that are certified by the Joint Commission, I always feel like for comfort, it's much nicer for a patient to have it done in an office setting versus a hospital or even a surgery center, because of the very how much attention one gets in a private office setting. At least in our situation, we try to consistently provide that. And I also prefer local anesthesia with light sedation, because this is the type of surgery that you really don't need general anesthesia for. Now, that's my opinion. Now, of course, this is an exception when it comes to this procedure on children. Of course, children cannot cooperate, therefore general anesthesia is appropriate. So again, I would recommend meeting with qualified, experienced cosmetic surgeons. This information should help guide you as you do your research and understanding where your ear fits in this scheme. When I looked at your photos, it looked like your antihelical folds looked pretty good, and it was a little bit difficult to tell whether the ears were prominent from the center part of the ear. But again, physical examination, there are certain standards, and then what I do is I try to look at how the ears look relative to the patient's face, and and how much they desire in terms of it going in. A lot of times people who have very prominent ears want them really flat and almost stuck to their heads, and that never looks right. There's a certain measurement, about 1 centimeter, where the ear is away from the bone, that it looks pretty good. But again, we customize the procedure for every patient. So I hope that was helpful. I wish you the best of luck, and thank you for your question.